And thank you for the honour as well. I've spoken at many meetings over, I hope I can be heard on this, it's many meetings over the years, but the first time ever that I've been a warm-up act for an ambassador. Never happened before, but if I was going to be a warm-up act for an ambassador, I couldn't think of a better country to do it for in the case of Cuba, particularly in the current circumstances. Now, contrary to, there's been a common misunderstanding that I'm a doctor, and I've had to, in many occasions, have to sort of make the, not so much talking to our union members, but elsewhere, to make the point that I'm not. And I invariably say, look, if anybody carks it here, don't come to me. Recently, I was giving a presentation in Waikanae on the Kapiti coast, and what happened was that I gave this little thing, and somebody soon after nearly did and had to be taken away. So I've got to moderate that line somewhat, just in case by saying it I generate someone nearly carking it, but hopefully not tonight. I lived in Christchurch for about 6 years in the mid to late 70s. 2 of those were as a taxi driver, and that was at a time when that industry was regulated. It was pre-deregulation. In other words, it was a time when you could make a bit of money. So in terms of what I want to focus on is the point really that about the Cuban health system, because in order to understand the Cuban health system, you've got to understand Cuba itself, and by doing that, it takes you into account as a part of the rationale for what's actually happening now in Cuba, but as US led. Now, Cuba is, if I can read my notes here, is about nearly 111,000 square kilometres. Compare that with the South Island, which is somewhere around about 150 kilometres. But on that 111 square kilometres, there's a population of 11.5 million. And in this case, in the South Island, a population of about 1.25 million. But notwithstanding that, Cuba is still the biggest island in the Caribbean. I was, for a short period, maybe about 3 years, member of a Trotskyist organisation in the early 70s. And that's how I came to know Comrade Paul Pierce there. And once you know Paul Pierce, you never forget him, despite best endeavours. But what that sort of showed, what I'm getting at there really, is that at that particular time, the focus was very much within a narrow range of sort of Marxist thinkers that you tended to sort of look at and follow. And it was after leaving that I started to widen the look, and obviously it was at Che Guevara. Now, I have got a vague recollection that he did something brave in at the time, in the Bay of the Pigs and back in '61. Now, I didn't have a clue what it was, other than some naughty people tried to invade Cuba, and Che was part of the fight back. And then, without thinking about it anymore, I've got a recollection of his assassination in October '67 in Bolivia. And about 15, 16 years ago, I did the Che Guevara Trail in the province of Santa Cruz. And I learnt 2 things about that. The first was that guerrilla warfare is really, really hard work. It's not easy. And the second thing was that I concluded that I was designed for comfort. I wasn't designed for guerrilla warfare. But they were tough times. The next thing about Che really was in terms of the special period, which is when the collapse of the Soviet Union and all that followed from that. And Louise can talk more about that or know more about that than myself, but what that people drew on Ponche's sort of points in this discussions he led a couple of decades earlier on the relationship between material and moral incentives. And that's significant because if you just have material incentives, you have a particular sort of economy. You can never not have, well, it's very difficult not to have material incentives, but if you don't have moral ones, you're in trouble if you want to go into a different path. But you can't go on a different path without them. And it led on to a view that I've maintained for some time and still do, that simply life is a constant struggle, and if you don't have struggle, you don't have consciousness. So I visited Cuba when I finished up with the ASMS. The ASMS, with the full name Association of Salaried Medical Specialists, way back in the days when New Zealand first had a sense of humour, they called us the Alphabet Union, and it was quite witty, I had to admit. But my wife said to me that you've got to get the union out of your system, the ASMS union, so best way to do it was to spend about 6 weeks in the Caribbean. And I must admit, it worked. And that included a couple of weeks in Cuba, organised by ICAP, the Cuban Institute for Friendship with the Peoples. The minor thing about the blockade is that it had to be paid for. And I couldn't pay ICAP directly. I had to pay, with their advice and assistance, into a Spanish account that then could pay back ICAP. And that's the sort of, at a very low level, some of the silly stuff that happens. Magnify that and you're in trouble. And I was certainly struck in the 2 weeks that I was there with the level of social cohesion in the country. This was, not right now. This was before the blockade intensified. A very relaxed environment. And I had many meetings, including visiting a community health centre. And I had 3 regrets. One is that I was to have a meeting with economists, and that had to get canned because other things came up. The second thing is I never got to taste Cuba's own homemade ice cream. Maybe another trip. And the third thing was that I never actually got to ride in a vintage car. Helen Kelly, for the photograph up there, did manage to do that when she went not long before she passed away. I was struck in terms of equality, or the relative lack of inequality, with our tour guide. And our tour guide was who'd previously been in the diplomatic service, and the way he described it to me, he was sort of in a larger country, larger than New Zealand. He was a bit like a deputy ambassador or the second tier level. And so that when you go from one to the other to a tour guide, it tells you something, a little crude indication. It was also interesting to see where we were staying, and a number of American medical students who were coming over to do internships and other things as well, which was a big plus. And the other thing that really struck me as well is these bloody cats everywhere. And I never really struggled to understand why there were so many cats, but they were friendly. They weren't feral. Until I understood, it was explained to me, I think, by the medical director of a centre, because they had their own cat there. They were neighbourhood cats. So I thought to understand Cuba in terms of in a more legalistic sense, it's useful to go to their constitution. They've had a constitution for many years. It's been revised over time. The last one there was 2019, and when I was over there, I had a session with a congresswoman there who was centrally involved in that development. And what it begins with is what you see up there. We, the people of Cuba, inspired by the heroism and patriotism of those that fought for a free, independent, sovereign and democratic homeland of social justice and human solidarity forged through the sacrifice of our ancestors. And then it goes on at some length. But the first group of ancestors they mention are the indigenous people of Cuba, most were wiped out, and slaves. And so it's quite a different type of constitution. And then under political foundations, Cuba is a democratic, independent and sovereign organised by all and for the good of all, founded by the labour, dignity, humanism and ethic of its citizens for the enjoyment of liberty, equity, justice and equality, solidarity, and individual and collective well-being and prosperity. Now, I don't think you'll see that, with the possible exception of Venezuela, maybe some other possibilities, of constitutions that are so proactive in terms of driving what actually happens and creating the scene for whatever happens. So then you move to the economic foundations. Cuba is governed by a socialist economic system based on the ownership by all people of the fundamental means of production. It's a nicer way of saying the socialisation of the means of distribution, exchange and production, or the other, wrong way around there. But as the primary form of property, as well as the planned direction of the economy, which considers, regulates and monitors the economy according to the interests of the society. And other parts of the Constitution, and these are just summaries of them, in terms of the economic foundations. The state directs, regulates and monitors economic activity and reconciling the interests of various parties and collective groups, etc., in that process. Workers participate in the processes of economic planning, regulation and monitoring. And the state promotes the advance of science, technology and innovation. And that's actually particularly important in terms of some of the things that Cuba has done in science, in medicine, at the high end of medicine, vaccines, and a range of things that you simply would not imagine in a country of that size. So the economy emphasises very strongly social welfare programs, those that providing subsidised education, healthcare and food to its citizens. Its services sector is the largest contributor to gross domestic product, nearly 74%. That sector includes tourism and it includes healthcare. The industrial sector, agricultural food, agricultural cement production, textiles, regrettably tobacco, agricultural machinery, 24% of GDP. The important point to note is that the economy serves the people, not the other way around. That's very defining, and that can easily, a lot of people can say that about any economy without it as a soundbite. But this is expressed very much in the Constitution. And that's the contrast with capitalism. And that's where wealth accumulation through appropriation of surplus value is the prime driver of the economy. And that's the challenge that Cuba presents to countries like the US and many others, is the exact opposite of the drivers. And it says a lot about, the Constitution says quite a bit on healthcare. All citizens have the right to life, physical and moral integrity, justice, security and peace, health, education, culture, recreation, sports, and to their holistic development. And that makes public health a right of all people. The state is responsible for guaranteeing access at all levels and free of charge. The state guarantees the right to a healthy home, a clear linkage between the social determinants of health that drive much of the health cost in our country and the health of people. And the state responsibility to ensure that all people have the right to a healthy and adequate diet. Now, this is in the Constitution. And that highlights the importance that the country puts on Cuba. Puts on health. The health system itself, and I had an opportunity to visit in Havana, a community health centre. The focus is very much to begin with on health prevention or population health, or in other words, doing the things necessary that people don't get sick in the first place as much as possible. Now, bear in mind that Cuba, since about 1960, 61, has had for over 60 years anyway. Some people call it a blockade. I think economic warfare is perhaps a more appropriate term. But they've had that going on, and yet the life expectancy in Cuba is just, and this is World Bank data, just a bit above that of the most powerful economy in the world. Ironically, the country that has imposed the blockade on the country that's doing better. And you can see the comparisons there with 79.5-year life expectancy. Central America as a whole is 75.8, South America 76.6, the Caribbean is 73.4 years, and New Zealand is 83.1. But New Zealand has never been subjected to economic warfare. In terms of the health system that we've had, many of my arguments have been with decision makers, is how they go to structure comes first. In terms of reforming a system, changing a system, you change the structure. The Cuban system very much follows, the functions come first and the structure follows. And if we'd followed that approach, then our health system would be in a far better state than what it is at the moment. But the community health centres are really interesting. And as I said, I visited one in Havana. Family doctors and nurses, primary care, GP care. Family doctors is another way we would call them general practitioners. Strong focus on prevention care that I mentioned. That includes immunisations and visiting people in their homes about immunisations. I was talking to this about to Michael Baker, who's a prominent public health specialist. He was in the media a lot, and he almost salivated when he was here at the approach to immunisation. But it also is a strong neighbourhood focus. Dental surgery is provided, and hospital specialist outpatient clinics. They are the bigger community health centres are roughly the same size of some of our very smaller DHBs, former DHBs like Wairarapa, Whanganui, Tairāwhiti up in Gisborne and in the East Coast. The second tier is where it gets reasonably close to New Zealand, similar to New Zealand's district hospitals or secondary care, but they're 24/7 acute care and emergency departments for more complex conditions and for surgery outside dentistry. And then you have the specialised hospitals, as we have here, like Starship up in Auckland, and tertiary care. Now, tertiary is, I always got a bit confused about what tertiary care, and a medical specialist explained it to me, what compared with secondary care, one is what, the other one isn't. But a better way, but then he went on to say that essentially tertiary care are low volume, high complexity. And that's why we don't have neurosurgery, which is tertiary care, in every sort of main hospital in the country, because in so many of those areas there's not enough patients to justify the workforce. So there are referral processes. Now, vaccinations is fascinating, really, and bear in mind, I don't have a scientific background or a medical background. But Cuba, and I think this goes back, I think, Luis, to Fidel Castro, perhaps in the late 70s or that, but he put a strong push on developing more sort of high-tech or extending science into the medicine of sort of more high-end medicine in terms of vaccine production and other things, because with a blockade, if you're cut off from the things you need, you can't actually necessarily import vaccines, and Cuba had to develop its own. And it has. And some of them, a number of vaccines that they have, some of them are international collaborations. In days gone by, they were sometimes with in American universities. But in cancer, for example, But in the case of with COVID-19, they identified a number of vaccines or vaccine candidates. But the ones that, and up there, the three that developed, and the vaccination rate was incredibly high in Cuba. And that saved lives. And I've certainly argued, and others have argued, that New Zealand should actually consider develop its own vaccines and learn from Cuba, because it would make a lot of sense. We already do vaccines for animals. The Malagan Institute of Medical Research is called for it, and Brian Betty, who at that time was the medical director, he's a GP in Porirua, of the College of General Practitioners, he argued that we needed the ability to produce and develop vaccines independently of overseas pharmaceutical companies. That should be an urgent consideration. Because at the moment we have to deal with big pharma. They're arseholes, they are villains, but there was a market for them. They were never doing anything about vaccines for viruses until COVID came along, and then they did. We would have been, although I think we handled our vaccination introduction in New Zealand very well, we would have benefited by actually being able to do our own or get them from Cuba. So the vaccination rates, Cuba up there at 97, nearly 98%. That's incredibly high. New Zealand's not bad, 83, 84%. Canada at nearly 90%. US at 79%, and Germany is a kind of an indicator of centre of Europe at 77%. But that's a phenomenal figure. Those figures are taken in the different countries from either in 23 or 24. You don't do that, you don't get that rate if your focus is on material incentives. If your focus is on moral incentives, on the well-being of the population, you get that rate, and that makes the difference. And then, of course, there are the overseas medical missions. I won't say much about those because there is so much to say, but they're really providing medical services to underserved regions. The focus has generally been on Latin America, Africa, and the Pacific. And the reason why they've been able to achieve that is by the heavy investment in doctor and nursing training and numbers. And I'll get to the doctor's numbers in a minute. And when I was getting to the Che Guevara Trail, and we stopped it and stayed overnight at a small town close by. The guide was telling me about, just identifying as we were going out for a meal, a group of doctors walking along. He said, the Cuban doctors here, they're working, providing care for our people. I can never work out from our guide, my guide though, why he was very pro Che Guevara. He referred to him as the commander. He revered Che. And this was not long after the Morales government had come into being. And he hated the Morales government. And I can never work out whether he was a right-winger with a powerful sentimental connection with Che, or he's an ultra-left. Yeah. It could be either way, but I couldn't work it out. And I remember being in a health conference, policy conference, I think in Boston, not long after the Haiti earthquake. And a couple of doctors got up and talked there about the first doctors that arrived in Haiti were Cubans, very closely followed by those from Iceland as well. And Iceland's not too bad. Now, I think I should have warned you. I thought I should have given you a bucket first, a vomit bucket call, but it is a funny world. It's what Margaret Thatcher said in the last cabinet meeting. She began it by saying, after she got the axe, from such a powerful position, she got the axe, and she said to her cabinet, "It's a funny world." Well, Comrade Brownlee, I went to your last predecessor, Bar One, hosted a function, well-attended function, not long after the Jacinda Ardern government came in. And Winston Peters was the Minister of Foreign Affairs and Deputy Prime Minister. He was there. But so was Jerry Brownlee. And we started talking. And he was out wondering about my interest in Cuba. And I was intrigued by his. And he said he went to Cuba as part of a diplomatic trip some years earlier. He got a bit crook. And so he was taken down to a community centre, and he just thought he'd be given some antibiotics or something. And he got a thorough examination, and he came away amazed. And I think that your immediate predecessor, one of the, I asked if he had a farewell function just before he left, and he said, I said, "Oh, have you had any contact with Jerry Brownlee?" And he said, yes, he was up here the other day. We had a cigar out on the deck there looking out. And he, of course, and you will recall because you were there, he hosted a function for the 21st anniversary of the of establishing an embassy, Cuban embassy in New Zealand. So Cuba has a supporter of sorts.
Like a rope supports a hanging man.
He's a bit too big to be. The rope wouldn't support him. So in summary, the points I would make is that the Cuban system is derived from its constitution, its health system, and that in turn is derived from the revolution itself. The constitution captures what the revolution aspired to and gave it powerful legal context and meaning. And that's how the system developed. So the role of the economy is to serve the people, not to enhance wealth accumulation. That doesn't mean to say that there's no trade and commerce in Cuba. In fact, we have trade and commerce are don't necessarily define capitalism by itself. Under feudalism, we had trade and commerce. We've had these hybrid societies over many years as one gradually transitions to another. And so, but the objective is to serve the people, and it's not wealth accumulation. And the role of the state in this context is both nationally and locally, is to protect and enhance healthcare as a basic right in a way that we go nowhere near in New Zealand. They put the function before the form or the structure of the system, and they also recognise the importance of sustainable health in a workforce. So there's a strong emphasis on health promotion and health protection, by way of example, big example, immunisation. There's a strong emphasis on health services being from community to tertiary being accessible. There's a strong emphasis on high-end science, including vaccines, and there's a strong emphasis on internationalism. I thought I had a slide here on the doctors who are trained and the per capita rate of doctors in Cuba, and it's all I can say, but unfortunately it's not there. All I can say, it is the highest in the world, and it is well above many countries, including New Zealand and Australia. And that's a reflection of how Cuba invests in health. If you don't invest in your workforce, and they wouldn't have the medical missions that they do if they didn't have that per capita range. So I think that is the lot, unless, yeah, that's me. Thank you.